Hello, and wishing you all a great day. I'm Dr. Sana Iftikhar, Assistant Professor Community Medicine and Research Consultant with Park One Health Alliance. Today, I shall be sharing the project updates regarding One Health EBS Surveillance Dashboard project, which is being conducted by Park One Health Alliance in close coordination with Ending Pandemics. First of all, a quick glance at the vision of this very project is to create an integrated One Health platform that allows early identification of disease outbreaks and its facilitation for a joint response. Keeping in view this very vision, a few of the objectives are that we should be able to derive appropriate ICT solutions across all One Health sectors to form rules and norms, and a very important one, to train key stakeholders in One Health and event-based management procedures, to create timeliness measures, and to demonstrate the created tools and manuals which have been created by the POHA team and to share them with the global world. Now, the features of One Health Surveillance Dashboard. This dashboard would examine One Health illness data for general usage while making it more accessible to pertinent decision makers from multiple sources across all One Health sectors. Implementation will be done in stages, beginning with the health and the livestock departments, and then expanding it to all the other departments of the One Health sector. Event cross notification would serve as the meeting point for all systems, and the intended sources for EBS would be such as mobile apps, SMS, WhatsApp, public online reporting systems. This current slide shows the conceptual framework behind this One Health EBS surveillance dashboard. We have ongoing information systems such as across human health, animal health, and vector-borne departments, vector-borne diseases departments. We will be retrieving the data from the ongoing information systems for all these systems, and then these data will be interpreted. Reports will be generated in the form of distribution of the data in the form of graphs and maps. And then this information would be of particular use to a number of important end users, such as provincial departments, health departments, important officials of across all One Health sectors, then even academia, universities, they can get benefit from it. And then not to forget a FELTP program, Field Epidemiology Training Program. Currently in Pakistan, information system across multiple One Health sectors is in place, but all these informations are indicator based. Just a quick look, we have a disease surveillance system, DSS, DHIS, which is District Health Information System. And now we are progressing towards District Health Information 2, which is a more advanced version of the previous one. Then we have a few of disease-specific information systems as well, such as for COVID-19, for dengue, and a very important one, 1122 Punjab Emergency Rescue Service. That is also retrieving a number of the data, and they also have a very good information system of their own. Indicator-based information will be retrieved from the sources just mentioned, whereas for event-based surveillance, an integral part of our dashboard, the sources of information will be social media reports, public web reports, like for animal health, environmental issues, etc. News feed section is there, mentioning important news items with a read more icon below. Summary of disease outbreaks in Pakistan is also presented, like dengue outbreak summary, dog bite cases report, and a summary regarding infectious disease spread post-flood disaster. This is all depicted and presented on the event-based surveillance page of our dashboard. Now, a quick look at the journey of the POHA so far. POHA started its journey in 2014 with a very important gap analysis study on leishmaniasis, and then there was no looking back. We have a number of important studies regarding it, such as antimicrobial resistance mapping and gap analysis study. Then COVID-19 readiness and resilience study, which was prepared after a very extensive tabletop exercise, and which was very adequately coordinated by POHA. And then this ongoing One Health event-based surveillance system. For this very project, this project initiated in April 2021, started off with an orientation meeting. And then, first of all, mapping and gap analysis study was conducted, its results were shared. Then consultative meetings also started side by side for the dashboard. And we are in the process of conducting training of trainer workshops, such as in December 2022 and so on. And very recently, in September 2022, we conducted a capacity building workshop for promotion of One Health for infectious diseases prevention and control. And this is just the presentation that how the manuals and workshop reports are being prepared by COHA. Such as the gap analysis report, then the One Health EBS training manuals and One Health training course manual. And then we have the reports of all the workshops, be it the training of trainers workshop and other consultative meetings, and these are available in software. This is the, first of all, the entry phase of the dashboard. Everyone wanting access to this dashboard requiring a username and a password. Once granted access to this dashboard, this is the home page. And in homepage, currently we have divided the diseases into One Health priority diseases and other diseases. Priority diseases data would be depicted in the form of a number of distribution techniques, as well as in the form of graphs, in the form of maps. On the right top corner of this slide, we can see a bell icon, which is for the alert generation. How it will work? If a number of a specific disease arises beyond a threshold, automatically alert will be generated, and just adjacent to it, there is provision for the notification. And email will be sent to all the important pertinent stakeholders in order to control that very increasing number of the cases. So this dashboard has the provision for alert generation and notification. Then, as all the current ongoing systems are indicator-based, but this dashboard also has the provision for event-based surveillance. At the top, at the lower right corner of this page, there is an icon for the event-based surveillance as well, and data will be retrieved from both formal and informal sources. If zoonotic diseases is selected on the home page, this is the very next page which comes. It has a number of the zoonotic important One Health priority diseases such as anthrax, such as dog bite cases, and extensive dog bite cases are available data. And data is depicted just in front of you in the form of graphs. And then if we select, if we want the data according to the district wise, it will be displayed over here. And if we want that data to be according to the gender or the age of the patients, all such distributions are available, such as in front of you. Here is this pie chart and graph form. Then, and a very important feature of this dashboard is the geographical display of the information. For example, the real-time data and where these cases are occurring according to their location, it will be depicted in the form of a map. After this dashboard, I would like to share quickly a few of the challenges and the opportunities which were encountered during this whole of the project. Unfortunately, there is no culture of information sharing among the ministries and the departments. They are working quite nicely among their own domains, but they are working in silos. One of the reasons might be that we have a strongly devolved administrative system between the federal and the provincial levels. Each one have their own priorities, plans, and there is limited cohesion with the federal level. Then we also witnessed a great deal of variation among the public health departments regarding the surveillance system, because the surveillance system of human health departments and animal health are quite up to date, but we have weak surveillance systems for the environment and the food sectors, which need urgent action. Almost non-existent SOPs for the intersectoral coordination, which need urgent action. Positive side is that during the recent epidemic, there is a ray of hope as well. We witnessed that when there was extensive collaboration and coordination, such as in the dengue epidemic of 2010-2011, these things were very adequately dealt with. So if One Health project is taken showing ownership, we can achieve this. Just in the end, we are moving towards the completion of the project. Soon we will be retrieving the real-time data for this dashboard from all the existing information systems, and we are competing for the piloting of this dashboard and then setting the stage for event-based decision-making, which will be the real success. Efforts are very much there to enhance the ownership of this project, and for that we will be sharing the progress reports, program reviews, and the workshop conduction so as to ensure the sustainability and ownership of this project. Thank you.